Good morning. Thank you for inviting me to speak on this very, very important topic about teen substance and alcohol usage. It's a growing problem. It's been always a problem, honestly, ever since when I was younger, they talked about it. But now with the legalization of marijuana and the access to everything, more and more problematic, especially in the United States. So we're going to talk about some trends first. The increased usage in 8th graders is 61% in the year of 2016 to 2020. And we can't even blame the pandemic. Pandemic actually showed a research of decreased usage because they weren't going outside and being outside. And 62% of 12th graders have abused alcohol. 50%, 1 out of 2, would have misused substances at least once during their teen. That's really alarming because that's 1 out of 2 kids. And more statistics. Early drug abuse correlates with substance use problems later in life, and the most significant increases in destructive behavior appear to take place among older teens and young adults. About 2 million, right, or 8% of 12 to 17-year-olds nationwide report using drugs in the last month. We're talking about just in the last month, not over a period of time. And among them, 84% report using marijuana in the last month. 21% of 8th graders, we're talking about they didn't even hit high school yet, have tried illicit drugs at least once. When I say illicit, I'm talking about the crack cocaine, meth, like the harder substances. And by the time they're in 12th grade, 46%, over that, of teens have tried illicit drugs. This is not even just experimentation. They're using it. And unfortunately, almost 4,800 Americans aged 15 to 24 died of an overdose because of the illicit drugs in 1 year. So which substance do you think is the most commonly abused? Oh, you guessed it. Alcohol is by far the most commonly abused substance among teens and young adults, maybe even all ages. So more statistics on alcohol. About greater than 7 million 12 to 20 years old report drinking in the last month. And remember, legal age is 21, right, to purchase. Among them, 60% report binge drinking. So amongst that number, they're binging, they're drinking a lot during that period. And 61% of teens have abused alcohol by 12th grade. I think I mentioned that earlier. Over 9% of all 12 to 17-year-olds used alcohol in the last month. About 10%, they're drinking. And this was alarming to me. 2.7% of the 12th graders drink daily, and probably not at home, right? Because there's usually not allowed that. It shows how feasible it is to obtain supplies of alcohol and how they can fake their IDs or get their older friends to buy it for them. All right, then. So how can we parents equip our kids before they face the temptation to use unhealthy substances? We'll talk about that first. And if there's anything that I want you to take home, one word, it would be this. To just take home this word more than any other statistics and what to do, what not to do, it would be relationship. Relationship. This is so important to develop, nurture, strengthen with our kids. The first part of that is showing curiosity, providing validation, asking open-ended questions. And we'll talk about that more a little later. The second one is being emotionally available. We all say, of course, be emotionally available. We have to do that. Sometimes it's not easy because we rush and say goodbye in the morning, and then we come back home and everyone's so tired. And we have to rush to make dinner and get them to do their homework. This emotional availability thing sometimes is not easy to do. It has to be very conscious. But we have to do that, developing a bonding, connection, deepening that secure attachment during this vulnerable time of the elementary, junior high, high school time. Because this relationship is the only way, right, to help maybe prevent the teen brain to taste that dopaminergic high, like the crack cocaine that can do. The amygdala and limbic system, it will never forget that first hit because of the way it manipulates that dopaminergic system in that pleasure center. So that's why prevention is one of the best optimal goal for this. About this relationship, understanding the importance of peers. Once they start hitting that junior high, they're going to act like, I don't need you no more, mom, dad. I want my friends more. And that is actually normal. And then they start to look to their peers for their decision making, right? More than parents. So we have to help them understand this about the roles of impulse control and the brain development, critical thinking, and how that's going to play in the teenage years. But some parents sometimes get really frustrated at their loss of control, and then they will gravitate more towards their friends, right? And so we have to still at least regard them as important to them because they are so important to them and work with that. The third one is knowing your kids' specific risks. To really see that during the teen years, it's a vulnerable time. And so sometimes they may have vulnerability or propensity for mental health issues. So even prior to it becoming worse, is creating protective factors, access to health resources, healthier alternatives to having resources. So having these activities being ready, enriching. Sometimes that's why I have mixed feelings about all these activities that parents have their kids do, like sports and music and band. And sometimes I feel like it's just too many. But then sometimes I'm like, if you don't have any, then they will become bored and not have that peer access outside of the classroom. And then lastly, and I want to just emphasize this is last because so many times it's the first thing that parents think they have to do regarding prevention, is knowing and explaining the increased risk. This is important, and that's why it's included, but I want to emphasize how it's kind of toward the end, right? We have to do all of the above as well. Understanding their reasoning for their pros and cons, right? Because it's their pros and cons. Not that there's a lot of pros, there really isn't, right? Between you and me, but to know what they are thinking, right? And we know that the teen brain is particularly vulnerable to negative effects of substances, regardless of what they're trying. Some parents are very liberal in the sense of they think, oh, marijuana is not that bad, so we'll just let them, if they're dabbling in that, as long as they don't do cocaine and heroin, right? That actually is very dangerous. Some parents also allow not experimentation, like allowing them to drink a few sips of alcohol at home at night. And I used to have mixed thoughts about that because Europe's minimal age or legal age of drinking is younger than United States. But I don't think teens can be taught to drink safely because their bodies and brains are within a stage of development that makes substance use especially risky. It's still developing even until age 25. And so kindling, I think that's what the word I'm going to use, in advance prior to that could be dangerous. And we don't know which child is going to have that risk. So why risk it, right? When I was in high school, and I remember learning about drugs and alcohol in elementary school, they had that DARE program and things like that. So I, I mean, they put the fear factor in me for sure regarding that. And somehow I kind of knew that teenagers are impulsive, maybe because of the uh, observations around me. And I kind of knew myself. I was like, if I taste that and I know it tastes so good, if I drink and I really like that feeling, I'm going to be in trouble. I'm going to be in trouble. Somehow, as a teenager, I kind of knew that. And so I waited really long before I tried my first glass of wine. Okay, so what about then? Oh, this is a really cool video clip I saw maybe a decade ago, and I wanted to include it here to give you this informational video. This is kind of like better than just listening to me about this piece.
Scientists first began to understand addiction as a brain disorder in the 1950s. Doctors Olds and Milner, in laboratory studies of rats, found the parts of the brain affected by addiction. But then in 1994, Doctors Volkov and Shelbert, top neuroscientists, ran CAT scans of the brain that showed the effects of substance use disorders. Like other diseases, these scans showed it affected tissue function. There are two main parts of the brain affected by drug use: the limbic system and the cortex. The limbic system, located deep within the brain, is responsible for our basic survival instincts. So when you do essential things to stay alive, like eat, drink, find shelter, have sex, or care for your young, your brain reinforces behaviors that cause the release of dopamine from this region. That reward for surviving is also transmitted to the amygdala and hippocampus, which records a memory of that feeling, so we seek it again. This is our survival hardwiring. Addiction also affects this area up here in the prefrontal cortex, which is what separates us from other animals. This is where decision-making and impulse control live. When drugs or alcohol are used, they activate the same dopamine process in the survival center. And when use is repeated, that substance can hijack that part of the brain. This hijacker changes the brain and weakens this system to make it believe that the primary need for survival is the drug. In hijacking the brain, it can usurp those primary motivations: food, water, shelter, sex, and protecting II. And the hijacker needs more and more of the substance to activate the same level of reward or feeling of pleasure, causing the brain tissue to become increasingly damaged with continued drug use. There are factors that put you at higher risk for the hijacker, including individual factors like genes and age of first use, and then environmental factors like drug availability. But if the hijacker takes hold, addiction is treatable. Advancements have been made in assessments, detox, treatment programs, recovery supports, and medications to treat addiction. Brain scans show that once in recovery, the tissue in the limbic system and cortex can get better. With your help, we can expand these innovations to help millions of individuals and families and ensure that addiction is treated as the medical issue that it is.
Alrighty, so how can parents respond when they learn their child already started vaping, drinks alcohol, tried other substances, and continues to do so? Well, first, take a step back and have some intercessory prayer, asking the Lord for wisdom and guidance, because it could be a long road. It could be a little bit simpler road, but asking God to really guide. Now, the two most common mistakes are the opposite extremes regarding the first reaction. And the first one of the two, some parents underreact, making excuses for their kids or denying the reality. They may not be sure what's going on, or maybe choose to not learn more because it's scary to try to do so. Maybe don't want to know. That's where that denial is, pretending nothing is happening. That's kind of dangerous if their kid is headed down to a destructive path. And then the second way is overreacting. Fear usually is the cause to lash out, react hysterically, trying to enforce punishments that are either too unrealistic to be followed through, such as you're grounded for a year, or so serious and damaging that they escalate to hostility and the kids want to be pushed further away. So parents who tend to overreact try to make decisions that sometimes can injure the relationship. Remember, we're talking about relationship, and unintentionally drive them into the addiction even further rather than steering them away from it. This is so tricky, isn't it? So discovering that a teen has started experimenting with drugs or alcohol, this is very, very troubling to any parent. And this worry can escalate into fear, and then making parents often feel like they're out of control. And then the anxiety increases even more. But we first have to acknowledge, right, even though we don't want to accept it, that the teenage years are times of exploration and experimentation. Not that it's like always right to explore certain things and experiment certain things, but that's part of their developmental stage. So when we find out this is happening, we have to try to avoid jumping into conclusions and portraying that you judge their usage as some mortal sin, right? So we have to kind of like calmly approach it. So once an individual has begun experimenting or actively using or abusing substances or alcohol, there's a strategy called harm reduction. Harm reduction, the premise of that is that everyone, and even older people, engages to some extent in risks that are part of normal adolescent development, during which that risk-taking and testing limits and challenging authority figures, it will happen. Get ready, right? The pillars of harm reduction can complement those of effective parenting. And there is a psychologist, Stanton Peele, who said common sense, time-tested parenting principles can be used to help parents cope more effectively with the challenge of child's risky behaviors. So we're going to talk about 4 aspects of harm reduction, these four lessons. And the first one is knowing. People do drugs for a reason. And like we do know that, but to know the specific, right? Our brains are hardwired to move toward pleasure and away from pain. I mean, that's natural. Like we're not meant to have pain, actually. Even before Genesis 3, everything was perfect. All of our needs were met. So the psychological benefits that a lot of people will share, and if you ask if your kids are using, they're very short term, but for them, it's like good enough reason. They'll say there's a sensation of reducing anxiety, soothing sadness, and coping with emotional pain. And then when you challenge that, like, what, then you want me to be in pain, right? They start to have that kind of manipulative spirit. And other reasons could include, but it helps me relax. I'm so anxious. I can't sleep without it. Sometimes they're very honest. It's just fun. Life is boring. And if I don't do it, I'm going to be left out. My peers, they're not going to like me. So this harm reduction strategy encourages us to think of substance use in these terms: the user's relationship with the substance. That there is this relationship. If you kind of imagine it as a person. And it's important for parents to understand when talking about substance use with your child, that there is this other relationship going on. And that's why I was talking about our relationship with our children in the beginning. Now, remember, acknowledging your child's drug use and like why they use it and understanding that, acknowledging does not mean you condone it. So what I'm trying to say is saying the words, I understand that's why you use it, does not mean you agree. It does not mean you agree. So a lot of parents are afraid to sit there and go, I see, that's why you use it. But it's not the same as condoning it. Maybe the child would look at it that way, but you have to first know the language I understand does not mean I agree, right? So rather than starting from knee-jerking to warning them about dangers and the negative aspects and the consequences, you will definitely go further if you focus on inquiring your child's own experience. Going there with that curiosity. How do you feel when you take that, when you use that? What does it do for you, right? And there's a difference between that curious way of asking it than the non-curious way, right? What's it doing it for you? How could that be so helpful, right? But really acting, you have to be a good actor and actress, right? What does it do for you, right? And these open-ended questions, active listening, it will open exploration and discussion, right? Each child has their own reason, and sometimes they reflect common issues that a lot of teenagers are going through. If they're saying anxious and depression, right? Some may take that as that's just an excuse. But maybe on the most part, there is some anxiety or depression. Or it's actually now causing more anxiety, depression, and causing a vicious cycle to keep using it. And then lastly, on this point, as adult caregivers, we often sometimes forget we were once teenagers facing similar issues and similar struggles, right? Now, the second point of the harm reduction is meeting people where they're at. And this begins in engaging with the teen in a supportive process, right? Not that you support it, right? But this process of being supportive, learning about their beliefs and attitudes about the drugs. That's what it means to meet them where they're at. Not that you're trying to align with them regarding that reason, but learning about them. Like really almost acting dumb. Like, okay, why do kids use it these days? Why do you do it, right? And be mindful, you may not like what they say, right? You might not like it. Sure enough, even in my practice, it's easier for me because I'm not their parent, right? And I'm their caregiver. I mean, their provider. I know how to really be curious because everyone's so different and I want to know their reason and I don't have this personal attachment, to them. And sometimes my eyes are like rolling right inside my head, like, really? Right? So, but it does require us adults to put aside our own attitudes and beliefs in order to listen. Not that you deny what you believe in, but just to put it on pause so that we can almost objectively listen. And that is so tough at times. So tough, right? But I do promise you there is power in this active listening, right? Which encourages dialogue and not quickly jumping into directives and advice and giving orders. And remember, listening does not mean you agree, okay? Listening quietly does not mean you condone it. Just want to mention that. So most kids, probably, maybe even your own kids, aren't very willing to discuss personal issues like their substance use or their love life or their preferences. As often they are anticipating parental disapproval or disappointment, or maybe worse, like the punishment's going to come if I admit it. And teens who are in conflict with their parents over drug use, they're often trapped in distrust and defensiveness. So no wonder sometimes when these kind of talks start, they start to engage with this like, I'm out. And they tune out from the lectures and the warnings. So one possible side door that could be successful is encouraging a dialogue, asking the child or teen about their peers' usage, right? Not directly at them, but like, oh, do you have some friends that you know that are using? Why do they use, right? Even though you already know your child is already using. And so that can kind of go around about that way and giving both the parent and the teen a shared context and this reality check. Maybe when they hear their own observations, they can realize what's going on. The third point of this harm reduction, oops, this was the third point. Small positive changes are still change. I really like this because, of course, change is desirable, but sometimes it's so overwhelming. And many people, honestly, resist change all at once. But parents, when they find out, they want that change all at once, like right overnight, right? Um, but if there are deep personal and family struggles, those take time as well. And sometimes the behavior of drug usage, alcohol usage and abuse and addiction, it's actually a sign or a symptom of something deeper going on in the family or in their own life. Parents sometimes get really flustered by their own lack of success to produce these changes and to do it swiftly, right? They feel like, and they start judging themselves subconsciously. I'm such a bad parent for them to even have started, or I can't change them quickly. And the expectations of the speed and the size of that desired change becomes unrealistic. So small positive steps leading to small improvements in the behavior, that's still an experience of success. And it can give everyone confidence and hope, driving the process forward. Oh, today you didn't start drinking in the morning. You started after lunch. That is definitely a small positive change. Yay! Um, and there's a funny case that I had where somebody was using marijuana every hour, right? And this is an adult, but obviously he started at younger years. For that kind of tolerance and to stay awake to do that every hour. And it was a very, very risky thing because he was on ADHD medications as well and also had a diagnosis of a psychotic disorder. So I'm in this almost like a parent, like I have to help this individual to stop using, but with a calm mind, I'm like, let's do it very slowly, almost so that you don't even feel it. Okay, so how many grams do you do, or how many bowls, or how many hours, right? So let's say he told me, yeah, every hour. Like, okay, so between now and next month when you see me, instead of 12 hours, can you do it 11 times? And he's like, oh, that doesn't seem so bad. I'm like, okay. And then sure enough, the following month, he's like, guess what? I only did it 9 times instead of 12 times. I'm like, yay! And I got all excited. And then only you would think like it's going to take 12 months, right? Because it's one hour at a time, but it was much quicker. It was much quicker. So wanted to give you that success story for him. It's very important to voice appreciation and encouragement for any positive change, even if it's very small like that. And there also will be times of perceived failure and going backwards. So we have to try not to be discouraged about that because recovery is never, ever a straight line, right? The fourth one is this one, very interesting. Some parents are under the influence that tough love is the only approach. And for example, they may be told that you have to have zero tolerance and you should kick your kid out. Maybe that's the only way they'll get their act together. So in the past, this tough love idea was very popularized as the only solution to the problem of drug and alcohol use. And frequently, the approach of the lockdown mode was used, like grounding, no cell phone, no internet, like whatsoever. This is in order to eliminate the risk, right? This is like the all of the efforts that we're trying. So this might bring temporary compliance, but it will show poor long-term success, actually. And tough love could even damage or destroy the child's life-sustaining connection to the only people that really truly care about them, right? So kids, they generally do better throughout the life when their parents or caregivers lead them with a gentle but balanced hand, staying engaged while allowing independence. Oh, this is a very difficult juggling act, right? And as mental health clinicians, we encourage family members to remember your child's strengths, that he or she is more than a drug user or an alcohol drinker. Now, there's also a notion that everyone with a very serious drug or alcohol problem addiction, they have to hit rock bottom, and then they'll be ready for help. But there's some research that shows that most people enter treatment or make positive changes in their substance use before without hitting rock bottom, actually. And so waiting for someone to hit rock bottom sometimes is because parents don't know what to do and maybe everything they tried is not working. It can be perceived as ignoring or avoiding the one who's struggling. And that could lead someone to feel like being abandoned, actually. So on the surface, they may say, leave me alone. I'll handle it. I know what I'm doing, right? But inside, they know they're in trouble. They know they are struggling and this could be a big problem and that they need help. So in the absence of violence and like there's going to be danger in the home to other siblings, kicking a minor out of the family, it could potentially be disastrous. So some final recommendations is, well, I'm a professional, so I'm going to encourage you to seek professional assistance and earlier than later, especially if you find out already this has been going on. It's becoming like the 4th month, 5th month, 6th month. That is not too early to seek help. And especially if both the teen and the parent are ready to go. You can't drag your teen too much, so there's some techniques about that. And the second is if you do meet, be ready to receive recommendations, right? Because sometimes during this evaluation, we will discover the comorbid problems of depression or anxiety or ADHD. And there's the statistics about untreated ADHD, undetected, untreated ADHD has a higher risk of drug abuse later, and earlier treatment lowers that risk. And if the diagnosis of substance alcohol use disorder has been determined, then remember, this is a treatable condition. It's a treatable problem. And we have to view that as a condition and not as an identity, right? Some parents are like, oh, that's it. They're going to grow up and they're going to be a drug addict forever. That is not true. There's a difference between viewing my kid is an addict versus my child is struggling with drugs or alcohol, right? And there's a difference between, child, you better not become a druggie. Not in my home, right? Versus, what's troubling you to feel that way? That you have to use this in order to feel okay, right? That this is the only thing relieving your stress. So there's a difference between those two questions and attitude, right? And of course, lastly, never forget that this is a spiritual battle, right? Jesus says in John 10:10, the thief comes only to steal and kill and destroy. I have come that they may have life and have it to the full, right? So we have to fight the spiritual battle in prayer, right, for our children. Even knowing what the risks are, knowing those trends, to pray in advance. If your child is not using right now, to almost expect that could be a temptation really in their face, and to be their quiet intercessory prayer background. The real enemy, is not the drugs, the influence of peers, or the emotional problem that led to their experimentation, right? The real enemy is Satan, right? And this is a Christian school, so I can say that, right? It is the devil, and he's the true hijacker, right? Making us believe that we have to seek and find our true identity and discover meaning in life and find our satisfaction and full freedom and find our hope in anything else in this world, when we already have that and already received that in Christ, right? So that's how he deceives, and that's how he's lying to us and how he's lying to our kids about that. So in prayer, right, I have this little suggested prayer that I created a while back, lifting up your child to the Heavenly Father. I'm going to use John and Jane because I don't know everyone's kid's name, but John and Jane is your child, and only by your power, that John and Jane can realize and experience their needs are met in Jesus, and therefore they no longer need or want these mind-altering substances and alcohol. Help me love them unconditionally as you loved me, and may this love compel me and my children to know and enjoy you more, resulting in our family the ability to connect with one another even more. Make our relationship so strong and deep to overcome the deceiving relationship my child has with drugs and alcohol.
This episode has been a production of the Capistrano Valley Christian Schools Podcast Network. Be sure to check out, subscribe to, and leave a review of this show and the other shows on our network on your podcast player of choice. Doing so supports the school community in a multitude of ways. For more information about the CVCS Podcast Network or any of our other shows, check out cvcs.org or email podcasts@cvcs.org. On behalf of the whole network, this is Mr. Jasper saying thank you again for listening, and stay tuned for more.